Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an August 20th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County's case total today is 1,858, which is 44 new COVID-19 cases since Monday when I gave my last update to the Dubuque City Council. I'm very sad to report we have experienced 3 more deaths this week, which brings the total number of COVID-19 deaths to 34 in Dubuque County. Normally I go into more detail in the various statistics for the state and Dubuque County. Today I'm abbreviating that. I'm sure you've all heard about the data glitch with the Iowa Department of Public Health and how the case numbers have been reported wrong. This glitch was discovered by the Iowa Department of Public Health in late July. What happened was the results of people who've been tested more than once have been backdated to the date of the first date they had a test. So for example, if you were tested back in April and were negative, then you were tested again in July and were positive, the positive result was recorded as happening back in April. And the same thing is true for those experiencing negative results. So what that means is, although the total number of positive and negative test numbers are correct, our current positivity rate and our 14-day trend line, along with some other stats, are not accurate. So why is this 14-day average positivity rate important? Well, it provides a current snapshot of community spread and the level of new infections versus always looking at the total numbers, which includes all the cases since last March. The daily and 14-day average positivity rate, along with the 14-day trend line of new cases, are key indicators for the K-12 schools, along with nursing homes. For schools, this number will be a major factor in the school's decision and ability to hold in-person attendance for schools, and the 14-day overall trend line is a factor for nursing homes, lifting some of their restrictions, particularly outside visitation. Remember, no visitors have been allowed in nursing homes since March. Yesterday, our 14-day average positivity rate dropped from 10.2% to 7.1%. We are putting a hold on updating our 14-day trend line and other statistics until the Iowa Department of Public Health assures us that the glitch is corrected and the data on the coronavirus.iowa.gov website is accurate. This is supposed to happen later today. So back to reporting the data that is accurate. As of yesterday, 10 Dubuque County individuals are currently hospitalized in Dubuque County, and about 70% of Dubuque County positive cases have recovered to date. And the average 14-day positivity rate will be somewhat lower than previously reported, as was indicated by today's report. And we'll know more on that after the state completes the website updates. We are confident our local calculated numbers will not affect the county schools' plans for starting the year off with in-person classes. One of the school metrics for being able to hold in-person classes is a 15% average positivity rate or lower. So the state added 1,328 cases since Monday. As of August 20th, 2020 at 1 p.m., Iowa has a total of 53,959 positive cases. About 9% of Iowans tested have been positive. Deaths reported in the state now total 1,013 Iowans. And currently, 300 COVID-19 cases are hospitalized throughout the state. And finally, about 79% of Iowans have recovered. So what is this person supposed to think after all that? Data is reported wrong, or at least some of it, and our planning and response is dependent, at least in part, on that. What or who do you trust? What should our actions be? I can assure you that the total numbers remain and the current number of hospitalizations and deaths indicate we need to continue with all the public health measures we've implemented and been practicing, including, but not limited to, the face coverings, social and physical distancing, and thorough and frequent hand washing. Regardless of the data mistakes, those recommendations are not changing. So keep practicing all of them and be more cautious about your actions especially as we embark on the start of the school year and our colleges and universities are also starting sessions. What we all do, regardless if we are in school or we have children in school, will affect the ability of children to attend classes in person, and we know that's the preferred and most effective way for our youth to learn and thrive. Thanks for tuning in today. And one more thing, continue to practice healthy behaviors by getting enough sleep, eating plenty of fruits and vegetables, taking time for physical exercise, and a time to reflect, meditate, pray, or just chill. And remember, we're all in this together.